Are you over 65 and navigating the complexities of aging with grace and vitality? Many perceive this stage as a time for slowing down, but it's also an opportunity for deepening self-understanding and exploring new dimensions of personal well-being, including intimacy. But what if some of the habits we've carried for years are now posing a hidden risk? Particularly when it comes to sexual activity, it's vital to understand how our bodies change after 65 and how those changes impact our cardiovascular system and hormonal health. Intimacy and self-love remain important aspects of psychological well-being at any age. Maintaining healthy practices contributes to happiness and reduces stress. Can seemingly harmless actions during masturbation become detrimental to your health? The answer may surprise you. We're about to reveal 5 crucial mistakes to avoid while masturbating after 65. Discover how to protect your heart, balance your hormones, and safeguard your overall mental and physical health. This knowledge will help you continue enjoying a fulfilling and safe intimate life while prioritizing well-being. Consider it an investment in your longevity and quality of life. Prepare to discover valuable insights that will empower you to navigate this important aspect of your life with confidence and peace of mind. As we journey through life, our understanding of physical and mental health evolves, requiring us to adapt our practices to meet the changing needs of our bodies and minds. While open conversations about intimacy and self-pleasure are becoming more common, specific guidance for older adults is often lacking, leaving many unsure about how to navigate these experiences safely and healthily. The physiological shifts that occur after 65 significantly impact heart health and hormone regulation. Conditions like decreased testosterone in men and hormonal fluctuations in women can influence libido, energy levels, and overall well-being. These changes, coupled with potential pre-existing conditions like hypertension or diabetes, create a need for mindful adaptation of intimate practices. This need is often unmet, leading to potential problems. Overexertion, combined with certain medications, or lack of awareness about body signals, can lead to cardiovascular strain or hormonal imbalances. It's a situation where ignorance isn't bliss, it's a potential risk factor. The goal is to bridge this gap by providing practical, actionable advice. We aim to equip individuals with the knowledge to address specific needs related to intimacy and self-care. By understanding these 5 critical considerations, you can continue to enjoy a fulfilling intimate life while safeguarding your heart, hormones, and psychological well-being. This information can be visually reinforced with diagrams illustrating the cardiovascular system, endocrine system, and examples of safe versus want to protect your heart and hormones while enjoying intimacy after 65. Subscribe now for more vital tips. Share your stories and questions in the comments. Your input builds our supportive community. Together, we'll navigate healthy aging, learn from each other, and prioritize well-being for a fulfilling life. Your voice matters. Understanding how to safeguard your heart and hormones while maintaining intimacy after 65 involves acknowledging specific risks and adopting mindful practices. The goal is to promote a positive, safe, and satisfying experience. First, avoid overexertion. Recognize your body's limits. Instead of striving for intense, rapid orgasms, prioritize relaxation and gentle stimulation. If you experience chest pain, dizziness, or shortness of breath, stop immediately. Think of it as a gentle exploration rather than a strenuous workout. Second, be mindful of stimulants and medications. Avoid combining caffeine, energy drinks, or alcohol with sexual activity. Discuss your medications with your doctor to identify potential interactions. Certain medications can affect blood pressure or cause dizziness. Third, prioritize foreplay and gradual arousal. Rushing into things can strain your cardiovascular system. Taking your time allows your body to prepare. Explore different types of stimulation and focus on sensual pleasure. Use lubricants to minimize friction. Fourth, never ignore pain or discomfort. If you experience pain in your joints or muscles, stop. Experiment with comfortable positions and use pillows for support. Consult your doctor if the pain persists. Fifth, seek information and support. Talk to your doctor or a therapist if you have questions or concerns about sexual function. Open communication is essential for addressing issues and ensuring well-being. With an aging global population, maintaining quality of life in later years is more important than ever. Discussions about sexual health often focus on younger demographics, leaving older adults underserved and potentially vulnerable. This gap in information is critical because the physiological changes that come with aging directly impact sexual function and cardiovascular health, making some previously harmless practices potentially risky. The increase in readily available information online also presents a challenge. Misinformation and generic advice can be misleading, especially when it comes to sensitive topics like sexual health. Older adults may inadvertently follow unsafe practices based on inaccurate or incomplete information. Moreover, the cultural shift towards embracing sexuality at all ages underscores the urgency of providing accurate guidance. People are living longer, healthier lives and desire to maintain active and fulfilling intimate lives. However, this desire must be balanced with awareness of age-related health considerations. Therefore, understanding these 5 crucial considerations is vital now to bridge the information gap, combat misinformation, and empower older adults to make informed decisions about their sexual health. Addressing these points promotes safe, satisfying intimate experiences while safeguarding heart health and hormonal balance, contributing to enhanced overall well-being and quality of life. To fully grasp the importance of these 5 considerations, let's explore some foundational concepts. First, understand the impact of aging on the cardiovascular system. As we age, our arteries become less flexible, increasing blood pressure and the risk of heart disease. Strenuous activity can put undue stress on the heart. Are you aware of your current blood pressure levels and heart health? Regular checkups are crucial. Second, hormonal changes significantly influence sexual function. Declining testosterone levels in men can affect libido and energy. Menopause in women leads to fluctuating hormone levels. How do these hormonal shifts affect your sexual desire and response? Third, medications can have a profound impact. Certain drugs can cause dizziness, lower blood pressure, or interact negatively with sexual activity. Have you discussed potential side effects with your doctor? Fourth, psychological well-being is intertwined with sexual health. Stress, anxiety, and depression can affect libido and sexual performance. Are you prioritizing your mental health? Fifth, communication is key. Openly discussing your concerns with your doctor or partner can improve your sexual experience and address any underlying issues. Are you comfortable talking about your sexual health? Visual aids like diagrams of the heart and endocrine system could further clarify these concepts. Let's explore practical applications. If you experience chest pain during masturbation, stop immediately and consult your doctor. Don't dismiss it as a minor issue. If you're taking medication for high blood pressure, monitor your blood pressure regularly and discuss any concerns with your physician. Some medications can cause dizziness, increasing the risk of falls. If you're experiencing low libido due to hormonal changes, consider hormone replacement therapy or other treatments under the guidance of a healthcare professional. Prioritize foreplay and gradual arousal. Explore different types of stimulation and use lubricants to minimize friction. Communicate your needs and preferences openly. Address psychological factors that may be affecting your sexual health. Seek therapy or counseling if you're experiencing stress, anxiety, or depression. Potential challenges include embarrassment or discomfort discussing sexual health with your doctor. Remember that healthcare professionals are trained to address these concerns. Be open and honest about your experiences. Another challenge is misinformation online. Stick to reputable sources like medical websites and professional organizations. Beyond the basics, consider exploring more advanced strategies. Mindfulness techniques can enhance sexual pleasure and reduce anxiety. Focusing on the present moment can improve intimacy and satisfaction. Pelvic floor exercises, often recommended for women, can also benefit men. Strengthening these muscles can improve sexual function and control. Consider the case of John, 70, who experienced chest pain during sexual activity. After consulting his doctor, he discovered he had undiagnosed hypertension. Managing his blood pressure allowed him to safely resume an active sex life. Another example is Mary, 68, who struggled with low libido after menopause. Hormone replacement therapy, combined with counseling, helped her regain her sexual desire and improve her overall well-being. These examples highlight the importance of personalized care and open communication with healthcare professionals. Don't hesitate to seek expert advice and explore various treatment options. Remember, maintaining a healthy and fulfilling sex life after 65 is possible with the right knowledge and support. Research consistently demonstrates the positive impact of sexual activity on overall well-being in older adults. A study published in the Journal of Sexual Medicine found that sexually active older adults reported higher levels of happiness and life satisfaction. However, it's crucial to acknowledge the potential risks. Data from the American Heart Association indicates that sudden strenuous activity can increase the risk of cardiac events, especially in individuals with pre-existing heart conditions. Expert opinions emphasize the importance of personalized care. Dr. Emily Carter, a geriatrician specializing in sexual health, states, "Every individual is different. It's essential to assess their specific health conditions and tailor recommendations accordingly." Anecdotal evidence supports the need for open communication. Many older adults report feeling embarrassed or ashamed to discuss sexual health with their doctors, leading to missed opportunities for diagnosis and treatment. A compelling statistic: only 30% of older adults report discussing sexual health with their healthcare providers, highlighting a significant gap in communication. By understanding these risks and prioritizing open communication, older adults can maintain a healthy and fulfilling sex life while safeguarding their heart health and hormonal balance. Before we conclude, let's address some lingering questions. Are you still unsure about how to approach the topic of sexual health with your doctor? Remember, it's a crucial part of your overall well-being. Prepare a list of questions beforehand to make the conversation easier. Do you doubt the importance of these considerations? A recent study showed that older adults who engage in regular sexual activity have a 27% lower risk of mortality. Are you concerned about the potential risks? By following these guidelines and prioritizing open communication, you can minimize those risks and enjoy a safe and fulfilling sex life. One expert noted that almost half of all adults over 60 experience some kind of sexual dysfunction, but less than 20% seek help. This just underscores the need to be proactive. Remember, maintaining a healthy and satisfying intimate life is possible at any age. Prioritize your health, communicate openly, and seek expert advice when needed. Let's recap the key takeaways. Avoid overexertion, be mindful of stimulants and medications, prioritize foreplay, never ignore pain, and seek information and support. Your next steps: schedule a checkup with your doctor to discuss your sexual health and any concerns you may have. Review your medications and ask about potential interactions. Explore different techniques and positions that are comfortable for you. The benefits of applying these insights are significant. You'll protect your heart health, balance your hormones, and improve your overall well-being. You'll also enjoy a more fulfilling and satisfying intimate life. Don't wait. Take action today. Your health is worth it. Share this information with your friends and family. Together, we can promote healthy aging and well-being. Leave a comment below sharing your biggest takeaway from this information. Remember, aging is a journey, not a destination. Maintaining a healthy and fulfilling sex life is an integral part of that journey, contributing to your overall happiness and well-being. By understanding these 5 considerations and prioritizing your health, you can continue to enjoy intimacy safely and responsibly. Don't let age be a barrier to pleasure and satisfaction. Explore other resources on sexual health and healthy aging. Knowledge is power. Empower yourself with the information you need to make informed decisions about your health. As the famous saying goes, you are never too old to set another goal or to dream a new dream. Embrace this new chapter with confidence and enthusiasm. Your best years may be yet to come.